Given some of the videos I've seen on Instagram, I think it's necessary to restate our vision of microscope use. And I believe a historical review of what we were thinking in 2005 would be productive for people to see. Is best characterized by Dr. Kim's view, as expressed in his Dental Clinics of North America essay in 2004. This is how it reads, and I quote, "Some enthusiasts claim that the microscope must be used for all steps of a non-surgical endodontic procedure. This may be a noble idea, but in reality is not needed or desired. Contrast that with our view that is best expressed in our Best Practices Handbook by Quintessence that came out in 2015. It reads, and I quote, "Working in an environment where the microscope is constantly being moved in and out of the field is extremely inefficient and tends to be very distracting for the doctor, assistant, and even the patient. Such a practice model fragments continuity of care, reduces focus and concentration on the task at hand, and has the end result that the majority of motions required are class 3, 4, and 5 motions, thus dramatically decreasing the efficiency and affecting both health and efficiency. You can see here we are talking about both the physical and cognitive aspects of ergonomics, especially as it relates to the fragmentation of care issues and the disruption of clinical focus and concentration that ensues by not using it for everything." So to start, let me first communicate what my vision is to you. And it isn't this, with a microscope in the background and the doctor hunched over a patient. Perhaps most endodontists actually work something like this. The idea that you pull out the microscope only when you really need it is one that unfortunately dominates our specialty, and it has had disastrous consequences for us as a specialty, and has had many deleterious effects, not all of which are obvious, unless you are a very careful observer. You may say, well, wait a minute, Gary, that is an artificial construct. But actually, it isn't. I know many people who work exactly like this, and I can post hundreds, perhaps thousands of pictures from websites that show exactly this sort of use. Doctors working at crazy angles, assistants standing up or in contorted positions, doctors shown doing some things with the scope and other things with loops, doctors shown using the scope as only a light source or a coat rack, and working in ops so poorly designed as to make efficient use of the microscope almost impossible. So let's make sure we state the argument accurately. As I wrote in Best Practices Handbook, the significant consideration in this regard is not, is the microscope required to perform this task, but rather, by performing one set of tasks with a microscope and another set without it, is ergonomically efficiency negatively affected? And the answer to that question almost always is yes. So let's frame the question a little differently. Instead, let's ask this question. What happens to your efficiency, your health, your profitability, and your frustration level, and your team members, and your organizational culture when you do some procedures under the scope and other procedures with the naked eye or loops? And when you answer that question, the answer will point you in our direction. We do everything under the scope, not because we need to, but because it's easier and more efficient and healthier. Our training is better, our culture is better, our enjoyment is better. And we do not suffer from either physical stress or the aforementioned issues with focus and fragmentation of care. The assistant and the doctor are completely focused on the case at hand without the distraction of going back and forth from loops to the microscope. So what is our vision? To review. 1, do everything under the scope. One way is to take the overhead light out of your op and force yourself to do it. Number 2, make sure your assistant can see everything that you can see. Remember, you are a team. 3, record all data ergonomically and contemporaneously. Accurate and contemporaneous record keeping is a function of ergonomics, and it affects both accuracy and profitability dramatically. Do your reports ergonomically, by which I mean finish your reports before the patient leaves the office. That's the single most important thing you can do to relieve stress in your office. This is our vision. I want to emphasize, this is not a new vision. We've practiced this way for 20 years, so we have some experience in knowing how to do this and where the stumbling blocks are. So this is how we work, doing everything under the scope from start to finish, always upright, almost never changing position. Today, we have GoPro cameras installed everywhere in our office, and the video material you will see today is from treating actual patients and represents an accurate portrayal of how we actually work, warts and all. Some of the older footage in these videos is almost 15 years old, and you will not see a lot has changed in that time, the way we work. All documentation is done in real time, not after the fact. Notice the monitor is ergonomically positioned right in front of the assistant, so she can assist and document simultaneously. And our records are done the same way, contemporaneously, and are ready before the patient leaves the office. Since we have worked this way for over 20 years, this is what I can promise you based on my own experience and having trained over 1,000 clinicians and assistants in that time frame. Number one, without question, it is easier to work this way, far easier. Number two, it is faster. Those who are properly trained know that it is faster, perhaps 20 or 30% faster. 3, it is better in nearly all regards. You may not think you need a scope to give anesthesia or to put a dam on, but I can assure you it is done better with a scope. I'll show you why today. It is demonstrably healthier to do everything under the scope for both you and your assistant. And number 5, we will show you why today it is also much more profitable to work this way. So it's easier, faster, better, healthier, and more profitable. Why do we have all this resistance? Why is this important? Well, 2 big reasons, your health and your profitability. First, some facts. 9 out of 10 of you sitting here today will experience some physical or mental impairment that will affect you or your practice and will compromise the quality of the care that you can deliver. 9 out of 10 of you. And 1 out of 2 of you will develop some form of disability in your career. The numbers are astounding and undeniable. These figures come from analysis of disability insurance claims in 1999, and the numbers today are probably worse. Occupationally related disease in dentistry is almost at epidemic proportions, and they include both physical and mental disability. The numbers suggest that your risk of full or partial disability over your career is 50%, 1 out of 2. Dentists almost always break physically before they break mentally, and most of the physical breakdown is due to musculoskeletal disorders or our repetitive stress kind of injuries. The cause of all this disability is related to both the repetitive motion injuries we are susceptible to, as well as the awkward ergonomic positions we are required to use treating patients. These are chronic pain syndromes developed over extended time frames and are difficult to collect disability claims on because the insurance companies today have developed careful strategies and small print policies that greatly limits their financial exposure. If pain in the back, neck, shoulder, arm, or wrist isn't enough to wake you up, how about pain in the wallet? I know of only 3 ways to increase your profitability: reduce overhead, increase fees, or become more efficient. Reducing overhead can help a little, but there's a limit. Ever try renegotiating a lower rent? Or try to reduce your workman's comp insurance premium? Good luck. So reducing overhead is not a substantial solution to the problem of improving profitability. You can increase profitability by increasing fees, and I've used this method myself, but in today's economic market, It is more likely you're having to reduce fees, not increase them, especially if you are in network or have an insurance-based practice, which many endodontists have today. You can improve profitability by becoming more efficient, and with the techniques I am going to show you today, perhaps as much as 30% more efficient. So our model and way of working deserves your careful attention. To believe in our model requires an understanding that the issue isn't that the microscope should be used only when it's necessary, but at its highest and best use is that it is used even when one doesn't think it's necessary. This is best summarized in our Best Practices book. For these reasons, we have learned that if the clinician can learn ergonomic techniques to perform all procedures under the scope, whether magnification is needed or not, then efficiency, focus, concentration, competence, teamwork skills, job satisfaction, profitability, and health are all enhanced, unquote. So the first thing you need to do is to understand that the model that says it is not necessary or desirable to do all procedures under the scope is a flawed and outdated model, and that you can realize a breakthrough by adopting our model and doing everything under the scope. So to accomplish any high goal, I say you only need to do three things. Number one, understand the possibility. Number two, figure out the details. Number three, execute the vision. That's all you need to do. The hard part many times is understanding the possibility. After all, if something isn't possible for you, it's hard to focus on any details, isn't it? But this shouldn't be hard today. After all, you've already seen some evidence that it is possible to work this way, yes? So this figuring out the details thing, that's the key, because there are a lot of little tiny details. So for the rest of this lecture, we're going to focus on some of those little tiny details. All that is involved here is some proper space planning and some ergonomic discipline, and you can do this. Think of just the added focus and concentration that you will have, to say nothing of the health benefits of being able to work muscularly relaxed in muscle-neutral positions for not only you, but also for your assistant. Think of what it would mean to your practice if you improved your efficiency by 30%. What's not to like about this? Doing everything under the scope from start to finish, anesthesia, rubber dam placement, buildups, oral cancer screening, testing, everything. We have yet to find an assistant that didn't just fall in love with this way of working. And assistants that learn this way will never work with a doctor that doesn't work this way. They know better now. We have a mentoring slogan in TDO for postgrads and new grads. Dream big, but focus small. Nothing wrong with dreaming large, but accomplishing those dreams requires a focus on a lot of small details. That's what we're going to do now. The first detail is the master organizing principle of the operatory, the circle of influence principle. If you understand this principle, you can design your own operatory far better than any designer from Shine or Patterson. The circle of influence principle is one of the foundational principles in our vision of endodontics. The principle states that everything you need and everything that your assistant needs to be within arm's reach without you moving, bending, or twisting. So looking at this from above, you get a better sense of how everything needs to be laid out. And the principle controls where you place the patient, where you sit, where your assistant sits, and how everything is organized in your treatment area. If you follow this principle, it's possible to become extremely efficient and to have your assistant sitting upright and always able to help you. As you look at this case, Joy is completely upright, doesn't bend, is only really doing class 1, class 2, and class 3 motions, and is completely upright through the entire procedure. This is a healthier and far more efficient way to work. For example, the placement of the radiography equipment, the monitors, the cart, the mixing devices, everything except what must be stored in a refrigerator, all need to be within easy reach. If you keep this principle in mind, It will constrain and determine the placement of almost everything in your op. It will determine the design of the back wall, the kind of seating you use, the size and placement of the monitors, the width of your op. It is what we call an architectonic principle, a design principle that determines all other elements of design. Even when the circle of influence principle is followed, there are two other large stumbling blocks clinicians face. One, a poorly configured microscope, and two, the wrong patient chair. Either one of these, or both of them, can completely frustrate a clinician's attempt to do everything under the scope. So they deserve your attention. If you have these stumbling blocks, please fix them right away. This video reviews some of the smaller details of these two impediments. The first detail involves a secret. And what is the secret? The secret is that you don't move the microscope. You move the patient. That requires a chair that swivels freely on the floor. So the first secret is have a chair that moves easily, that you can move with your knees. If you look at any of the video, you'll see that I am moving and focusing the patient in the chair all the time, and I'm not moving the microscope. I'm just moving the chair with my knees. This is absolutely critical to the efficient use of the microscope. So most people are fighting their chair. They can't easily move their chair, and therefore they have to move the microscope. Here you can see I'm doing an exam, doing some probing, and I'm moving the patient and chair, not the microscope. The second thing is have the right microscope. This requires a 6-step microscope, or a microscope that goes down to 2.1x. Why? Because you need 2.1 to 2.2x to really be able to do everything under the scope. You need to see from the bottom of the chin to the base of the nose all in one view to do all of the things you need to do under a microscope. So if you have a 3, 4, or 5-step microscope or a Pico, you can't do this. This is what you see with a 5-step. This is a 6-step. You can see the entire mouth, and you can give anesthesia, you can do an oral cancer screening, you can do multi-tooth testing very easily with this wider view. Here you can see the difference in magnification. The 6-step microscope is on the left, and you can see at 2.1x, you have plenty of breadth of vision to do what you need to do. On the right is what you see at the lowest power of the 5-step microscope. You don't have the same breadth of vision, and it's very difficult to do everything under the scope. Next, let's review our system to classify motion so that we are speaking the same language.